Welcome, friends, and thank you for tuning into another episode of the Optimal Health Program. I hope you're all doing well. Today we have a few cool things to talk about. As always, we start with a little bit of a nutrition update, look at some of the research, and we'll go on. We have a lot of emails to the website, and people have some really cool questions. So although some of the questions are duplicates, I grab a couple of different ones and pull them so we could talk about them because it's appropriate for just about everybody who's listening. Everybody has issues with fatigue and aches and pains now and then and hormone decline. And how do I learn about my body? How do I do a blood test? What does this mean? So, doing this for so many years, it becomes easy to put everything into perspective and then to understand exactly what we need to do. And when you're looking at many things, as I've said a few times, the blood test checks about 230 things. You learn more, you fix more, people get better. So this is not just throw you on meds and watch you fall apart. The phone number today, as always, 1-888-420-9272, 1-888-420-9272. If you're listening or watching on YouTube or Spotify, you can send us a little note, a little message. Tell us how much you like the program, how much you like my nice brown tweed-ish sport jacket. And my co-host is not here today. So Louis he's taking a little day off. He's going to hang out and chill. Okay, so interesting articles. One of the first things we'll talk about is a study on cadmium. Cadmium is a heavy metal. It's really horrible for you. And unfortunately, a lot of people have a pretty significant cadmium load on their body. Lead, mercury, and cadmium are in lipstick and makeup, so a lot of women will have it in that exposure. In other cases, people may be getting it in the water coming into their home if you don't have really wonderful reverse osmosis filtration to filter all of these things out. We've had patients that come in with weird heavy metal burden. We check their blood and urine, and we don't really understand why they have so much of this or that. But then when we test the water in their home, a lot of times that's the culprit. That's where it's coming from. So this is a great study and published in one of the major medical journals. Talks about immunomodulation by heavy metals as a contributing factor to inflammatory diseases and autoimmune reactions. So this cadmium is an example and can damage just about any tissue or any part of your body. It's, as this study describes, a unique hazard because its biologic half-life in humans is 20 to 30 years. So when metals come on board, they're in your blood for a short period of time, and then they go into your cells, and deep reservoir is your bone. But 20 to 30 years, this stuff is accumulating in your body. So it can cause a variety of different problems, organ disease, failure, as obviously the extreme outcome, autoimmune disorders, inflammatory cascade. If it affects your gut, then you're not absorbing your food or your nutrients. You could extrapolate that and use your imagination to see how bad it is for every single part of your body. Cadmium is directly linked with breast cancer, so the list goes on and on. So now that I've scared the hell out of you, which I typically do with all my patients, a little bit, not too much, just a little, to kind of bring my point across. You need to test your blood for heavy metals. Blood labs look at 5 metals, and then you want to do urine because it's more accurate. Urine looks at 21 metals, and urine's a better reflection of what's leaving storage. So that's the way we can determine what's on board. And we'll do an IV, a chelating IV with calcium EDTA to pull metals out into the urine and then check the urine to see what we pulled out. So those are the ways to test for and then also to get rid of these things. But this research is ongoing. There's more and more coming out. And every time I get on the computer, which is literally every day, either at home or at work, I find more worrisome research that talks about these things, the metals. So everybody should test for these things and get them out of the system. Absolutely, and right away. Another interesting study talks about more than half of the world's 8 billion people will be overweight by 2035. And that's kind of just around the corner. 10 years, more than half of the world's population will be overweight.
Crazy.
And of course, that leads to more heart disease, more hypertension, more diabetics, more joint issues, more cancer. Just, it's bad. But think of that for a minute. More than half of the world's 8 billion people, more than 4 billion people, will be overweight. Think of that for a minute, and you start to understand that, this is a very, very bad scenario. People are eating the wrong foods too much, not enough exercise, not taking their vitamins, not correcting or looking at their hormones. It's just bad. Of course, the drug companies are super thrilled at that because, more and more meds will be created to address that. But as I tell all my patients, I talk about 5 different things that you could do to help to bring your weight down. In the same vein, no pun intended, that'll bring down your cholesterol, bring down your blood sugar. But you can't just do one thing, like a weekly injectable, and expect that to take care of your entire picture. It just doesn't happen. It doesn't work that way. I've added the weekly injections for some people who opt to want to do that or who need to do that. We'll talk about that in a minute. But we always talk about cutting down carbs. Cut back on the sugar. Your body tends to burn the fat better and faster when the sugar's not in the way. Exercise every day, a half hour or 45 minutes of something. Everyone in the world should be doing exercise every day. Yeah, young kids don't really need it. People who are lean and healthy. You still should do a half hour to 45 minutes of something because it floods your cells with oxygen, vitamins, minerals, hormones, burns cholesterol, sugar, fat. It does great things for your body. Keeps your blood vessel tone in good range. It relaxes your blood vessels to receive more blood flow when you're exercising. So low carb exercise, correct vitamins, minerals, hormones. And then if you need to or want to, you can use the injectables weekly just as a helper. I don't know that people need to be on them forever. I don't think so. I don't recommend doing that. But if we do it initially for 3 months and people get a good result and they're taking themselves out of the danger zone and there's no negative effect from doing them, because we'll check your blood work for pancreatic enzymes, amylase, and lipase, you can do that. And the argument that I have and the discussion that I have, not as much an argument with some patients. They say, oh, don't do that. Is it risky? You're in a bad state. You're in a bad zone if your sugars are really high or if your weight's really high or if you have plaque in your blood vessels, because we do cardiac testing in the office to look for plaque in your head, your neck, your heart, your legs. If you're in a bad zone, that might be a great idea to be able to get you out of that danger zone, help you kind of get you over the edge to be able to create your results. So it's got to be done with a real thorough, comprehensive medical nutrition approach, the big blood test, putting everything together, and you get your best results. Throughout the winter, we have a lot of people coming in for vitamin C IVs. And this has been going on in my office since I started many years ago. I graduated medical school in 86, which if my calculations are correct, that's 39 years. Someone have a calculator? And in practice since 88 in my office in Garden City. So, understanding how the body works and how people work and seeing, I don't know how many thousand people. It's got to be close to 50,000 people because I worked in different offices, East Meadow, for a very long time from 88 to 2015 or so. Had an office in the city for 13 or 14 years, saw tons of patients there. Between both offices back then, we were booked 4 months in advance. Couldn't get an appointment without a cancellation list. I worked in Queens at one point, Plainview for 14 years. So I've been all over the place. But the overall idea is that I've seen so many different things on so many different people, all types of people with all sorts of different contributors and backgrounds and diets and such. You get a pretty good idea on how to understand things and fix things. So we want to put together recommendations that work well for you. So over the years, we've always done vitamin C IVs. When I first started my practice, we started doing it. And people would get great results having colds, coughs, flus. They feel tired, achy, weak. They'd come in with Epstein-Barr or cytomegalovirus infections. And doing some of the IVs over the course of a few weeks, they feel great. And there's many years of research that supports that, much more so now than ever before. As I talk about vitamin C research, if you go to Google Scholar, which is one of my favorite search engines, and plug in intravenous vitamin C therapy, you'll get anywhere from 1,300,000 to 600,000 studies, citations talking about vitamin C IV helping to inhibit cancer with and without, medications and chemo, et cetera, and vitamin C inhibiting and killing viruses, including Epstein-Barr, even with hepatitis, COVID, et cetera. So the list goes on and on. Great stuff. So the interesting thing is that a lot of the patients over the years who are roughly Medicare age, 60s and older, 65 and older, would come in through the winter once or twice a month just to get their vitamin IV, because they would say consistently, doing the vitamin IVs, I don't get the colds anymore. I don't get the sinus issues. I don't get the headaches, the sore throat, other infections, and it makes me feel good. So for those individuals, we do that. And that works. That's part of their perfect plan to stay healthy and fit. Just like someone else, we may recommend a thyroid hormone, or we recommend DHEA or testosterone therapy. For these individuals, it works well for them. So that's why we track it, we do it, and we prove our result. This is a great study in the World Journal of Critical Care Medicine about intravenous vitamin C, helping with enterovirus, rhinovirus, and acute respiratory distress syndrome. There are lots of other studies that talk about vitamin C IVs helping with sepsis. That was a pretty big study. It came out a couple of years ago. I don't know where I put that. But another study about Epstein-Barr virus and vitamin D deficiency and MS risk. So we've known for many years that people that are low in vitamin D have higher risk of all infections and other weird things and autoimmune disorders. If you look at people who live near the equator where there's a massive amount of sun and their vitamin D levels are very high, through the roof, according to what we would typically think of as normal, they don't get the MS, the Parkinson's, all of the different disorders that we have and the cancers. And the idea in all journals and all medicine is that their vitamin D levels are so high, they believe that that prevents these things from occurring, and it makes your body healthier and stronger. Your bones are stronger. And then in the same discussion, people who live in the northernmost climates that don't get the sun and don't get the vitamin D have all sorts of bad things that happen to them, including all those metabolic infectious disorders. So my comment there is everybody should test for all the vitamins, and certainly vitamin D we have to test, make recommendation, and put that into the range so that you're somewhere between 80 to 100 on your blood test. That's where all the best things happen with vitamin D. The blood levels typically, all labs will say, are expected between 30 and 100. So 80 or 90 is not overdoing it. Although 30, 40, 50, people still seem to have problems and don't have great result with their immune response and with bone protection. So we make vitamin recommendations specific to each individual so that we get the result. The whole point is to get the right blood test, get the result. So that's what we're striving for. Okay, phone lines are open. If you'd like to call in to ask a question, you can do so now. 1-888-420-9272, 888-420-9272.
We have some questions.
Let's go to a question.
All right. First question. What is NAC? Similar to NAD? Question mark.
NAC is N-acetylcysteine. It is an important part of the free radical binding ability of your body. N-acetylcysteine typically can convert to glutathione. Now, you're not going to be taking or be able to take a lot of NAC orally to create the glutathione, or take glutathione orally because your digestive enzymes in your stomach might typically interfere with that, break it down, so it wouldn't work. So we do intravenous glutathione. We go right to the active component and put that on board. And for a lot of people, it makes a world difference with memory, focus, brain function, free radical binding, etc. N-acetylcysteine is also in a medication called Mucomyst, which for ages has been used for asthmatics with inhalers to try to break up mucus in their airways. So there's a lot to be said for N-acetylcysteine in that realm, a lot to be said for glutathione intravenously, and to some extent there have been people doing glutathione shots, injections, but it doesn't really do much because you're not injecting a lot of it into a muscle. You can't inject a whole IV bag of glutathione into the muscle. So the IV is the best form, and glutathione is a million times more significant than NAC. But NAC is important. Thank you for your question.
We got another. Do you like gravity-fed water filters like they have like Berkey?
Gravity-fed water filters. I have yet to see something that says it's going to make a dramatic difference just because of gravity-fed. I like water filtration systems. I like triple reverse osmosis filtration. Typically, and there may be more companies now, but Culligan has always had certified reverse osmosis filtration systems, Aquapure as well, and there may be half a dozen or more of the others, but you want to have something that has some certification with it so it takes out everything. Chemicals, pesticides, heavy metals, bacteria, viruses, etc. You want that water in every speck of your home to be as pure as humanly possible. You don't want to have things going into your bathing, drinking water, cooking water. And as we've said, you don't want any of the plastic bottles that are holding the water that you may drink or use, because at some point those plastic bottles may be sitting out in the sun somewhere, and the bisphenol A that comes from those plastic bottles and Nalgene from other types of plastic bottles, as well as heavy metals. And we spoke about this a couple of weeks ago. Right, Frank? So You don't use plastic, only use glass. And for all of my patients, I tell them, get the triple reverse osmosis filtration system in your home, so every speck of water, even ice cubes that you make, will be pure. And get a very big steel cup or mug. The one that I have is made by Stanley. And I don't know if I got that in Home Depot or Whole Foods. I forget where I got it, but it's a gigantic steel cup. And I put water and ice in there, maybe squirt some lemon in it or put a slice of orange or something in it, and just drink that and keep drinking that. But take it from your home so you know that that water is perfectly safe and pure. It's what you need to do.
Right. All right, we got one from Instagram. What are the typical medical criteria or credentials for someone to be prescribed Ozempic, etc., for weight loss? Are there specific BMI thresholds or health conditions that's considered?
It's not as though there are specific BMI recommendations. So I think that doctors like myself want to understand what's happening with the individual if they've tried to lose weight and they can't, and they're doing an appropriate diet. I talk about low-carb diet. They're doing some exercise. They can't get the result. In my world, I would do the big blood test, examine them, learn everything about them. Oh, look, your thyroid's really low. Let's correct that. Then they may start to lose weight, and they may not need to use the Ozempic. So once I do the workup, we find out what's happening, and we're guiding them with a low-carb diet. And most people don't do it as tight as they should, but that's neither here nor there. If they're in a danger zone, if they have plaque in their blood vessels, coronary or otherwise, if they're becoming diabetic, pre-diabetic, if their cholesterol is high, their blood pressure is high, all of these other bad things are happening because of this overweight, then it's a good add-on, as I say, to do it, maybe for a couple of months and see what kind of result you get. I don't think you have to have a gigantic BMI or have to be 100 pounds overweight. I think there's some people that are at risk when they're 30 or 40 or 50 pounds overweight. So in my world, we try to get people healthy, lean, but all their blood work coming to the best range. And we don't have people on, these meds for year after year because we get it all done within a shorter period of time because they have to do the low carb, the exercise, correct the hormone levels, the vitamin levels, because that really enhances the overall effect. I just use this as an add-on, so maybe that's a better way to say it. I don't do it as a primary. I never would do it as a singular therapy. I don't do it as an add-on. I don't do it as a primary therapy. I use it as an add-on.
We got another. What is good for gallbladder health, Doc?
So you may want to change your diet because whenever you eat fat, the gallbladder is working a little bit over time because it's taking bile from your liver and going to push that into your intestine to help to break down fats. Some people that have a slow gallbladder or some people that develop sludge, they have to be very careful what you're doing with your diet. And there are some books, I don't know because I haven't looked lately to see studies on it, but some people using warm water and lemon as a little bit of a initial drink for breakfast just to try to see if they could enhance the gallbladder function. I've heard that over many years, and it may be more of an old wives' tale than a factual recommendation. And there are books out there that will say, talk about a million different things. There's an interesting book I have. It's about 3 inches thick. It's called Prescription for Nutritional Healing. But it's got nutritional recommendations for every disease known to man. And it's a nice book, nice idea. But I've seen some patients that have tried everything under the sun that's natural, but we're doing things that never hit the nail on the head because they didn't know what the cause of the problem was. So although I like the nutritional books and I like the low-carb and nutritional type diets, et cetera, you have to be really careful with that because you may be doing something and not really hitting the nail on the head. So that's why the workup is the most important thing to do. Okay, phone lines are open, 1-888-420-9272. If you'd like to call in to ask a question, you can do so now, 1-888-420-9272. Let's see. We have lots of emails to go through. And John says, what vitamins should I take and how do I know what to take and when? Well, the only real way and correct way and perfect way to take vitamins is based upon your blood test. If you randomly go to a store and you're going to a store that's got discount vitamins or inexpensive combinations of tiny little amounts of things, you may not be correcting your requirement. And your requirement is based upon age, because when you're young and more active, you're going to need more of certain nutrients. And if you're older and you're not absorbing as well, you would need more of certain nutrients. So your blood test tells us what your vitamin levels are. So based upon that, understanding the activities you're doing, I would recommend vitamins for you based upon what I know will work. And I know ranges of vitamins for people. Put those together. And then as you start those and you're doing your activity, we would recheck your vitamin levels within a month and then prove that everything's working. Or if 90% of them are better and you're in a great zone and a few of them need to be fine-tuned, we can do that. So testing, recommending, and retesting is always the perfect way to put vitamins on board. Short of that, you're just kind of guessing. And to an extent, if you're guessing and you're not meeting your requirements, you're not covered, you're not protected. Some people think 500 units of vitamin D is a lot, and they don't want to go past that, which is not going to cover what your body needs. Once again, 1-888-420-9272. If you'd like to call in, you could do so now. Go ahead.
Got another one. Just started taking vitamins. Why does urine sometimes turn a bright neon color after that?
Yeah, that's kind of typical. So in some cases, when you take in things that are highly concentrated, your body starts to push out concentrated and waste products from metabolism. So that may very well be the case. Depending upon fillers, binders, excipients, and nutrients, that could also happen too. But I'd much rather have the vitamin levels perfect in your blood based upon recommending and testing the blood and having some freaky-looking urine in that realm because it means your body's in a much healthier place. So it's all about what's going on in your body that you're meeting your requirements.
Yeah, that's actually, I've always wondered that. I won't lie.
Well,
good to know.
For sake of discussion, a lot of people out there like Chinese food. And I used to, have Chinese hot and sour soup. Delicious, hot, but you have something that's that concentrated, the same bizarre thing happens to your urine because your body's trying to dump things to even your pH in your blood. So your pH has to be roughly 7.2. It can't go up much. It can't go down much. Your body, every millisecond, is protecting that pH so your body's doing well. If you're taking too much acid, you'll pee out the acid. You're taking too much alkaline, you'll hold on to the acid to keep that pH the same. If it's too much concentrate comes in, your body will get rid of that. Or your body will start to get really thirsty so that bringing in water will help to balance out the concentration of your blood. Your body is the most complicated, exquisite, mechanical, biochemical, electrochemical mechanism in the world. There's nothing more complicated or amazing to see or understand when you learn about the body and how it functions.
Wow. Wild.
Cool stuff. 1-888-420-9272 if you'd like to call in. The office phone number is 516-794-0404. The website's drcalapai.com, CALAPAI. And we love for you to call or leave us a message, text, email. Let's see, our next caller is Vito, wants to talk about weight loss. And how is it so that some people taking the injectables, the GLPs, are not getting results, so they have a slow progress? It's because they're only doing the injection. So I see this every day. People are going and getting, which unfortunately has become expensive. The pharmacies are charging, it seems, between $800 to $1,200 for a month's worth of the injections. We don't, but we can get it in bulk, and our fees are dramatically less. But if the only thing you're doing is the injection, your body's not going to get the result. You may have less appetite, but you really need to do the exercise, the low carb, and correct declining hormones and vitamins to get your best result. And when you get off the injectable, you'll still continue to get the result because you're still doing the low carb, the exercise, and have corrected your hormones. So that's why the combination of all these things works the best, so you don't have to be on the medication forever. Let's go next to Maria. After childbirth, she's had low back pain and some sciatic issues. So I don't know if there are videos that show you what's going on with your spine during childbirth, but, the changes are pretty dramatic. So in a young woman who's got nice, strong ligaments and tendons, and they're holding everything together, the sacroiliac ligaments that go from your sacrum, which is this orange thing here. Can you zoom in?
Yep.
No. If you're zooming in and can see, and we ordered a top-down camera, so folks, just stick with us a little bit. We'll be able to do this at some point. The sacrum here is a triangular bone between the ilium, and the sacroiliac ligaments are really important, really strong. When people have accidents and such, car accidents, sometimes they're torn, and then all of a sudden there's too much movement. They start to have a lot of low back problems. The sciatic notch is over here, just to the side. And if there's pressure on that sciatic nerve coming out of that notch, that'll cause pain. But all the ligaments that hold your low back and your lumbar and your ilium, also some of the pelvic ligaments in the front, are stretching out to accommodate bringing this developing fetus, which sometimes are very large, through a relatively small exit. And in doing that, stretching all of that, depending upon how big the baby gets inside, makes the ligament stretch out a lot. Then it becomes difficult for those ligaments to start to come back and become tight and strong again. Because once you stretch ligaments, and to some extent tendons, they don't really start to just come back to where they were. So a lot of exercise would help. Sometimes we'll do injections into ligaments to stimulate healing, PRP, or stem cell therapy, sometimes prolotherapy. So typically, as you have children, all of those things stretch out, and that can give you discomfort and pain. It's treatable, and again, doing exercise, physical therapy, and then some of the injection therapy can help to bring that back into a more normal ability and function. Okay. Phone lines are open, 1-888-420-9272. If you'd like to call in to chat, we can do so. 888-420-9272. Also, we have a text from Sabrina, pain in her knees, and this has been ongoing over the past few years. The more that we run or do activities, sooner or later, ligaments, tendons, and cartilage will have some wear and tear. And a lot of the people that I see with ankle, knee, and hip and low back problems have been runners. And some people run and love to run, and it's okay. But if you start to have damage in your joints, then it's not, to your advantage. People that run on softer surfaces, some people who run with better shoes will have less of the problems. But to some extent, this is what sets the stage for ligament and tendon wear and tear, and damage, and damage to cartilage, etc., discs. So the MRI is always the best test. And similar to what I was mentioning before with Maria and her childbirth issues with low back pain and sciatica, you can see the ligaments and tendons nicely on the MRI, so we can see exactly what needs to be done. For knees, some people might be predisposed to knee problems because of genetics or history of back problems. But MRIs are done to be able to look at the meniscus, the figure of eight cushion between the joints, looking at the medial and lateral collateral ligaments, the cruciates, and see exactly what's happened there. And to some extent, depending upon how much damage, then we could work with that either by doing some prolotherapy, but when there's a decent amount of wear and tear, PRP and usually stem cell therapy, which will help to create, repair. And there are some great videos on the website about stem cell therapy for these things, so you can take a look at that, drcalapai.com.
Got a question from YouTube.
Okay.
I've been struggling with chronic migraines for the last few years. Are there any lifestyle changes, supplements, or lesser-known therapies that you would recommend exploring? Nothing seems to be helping.
So the interesting thing that we see with migraine is that probably 70% or maybe more of my migraine patients through all the years have some hidden or delayed reaction to a food or a chemical in a food. Sounds crazy, but it's true. So all people that I see with migraine, once we examine them and get an understanding as to whether or not there's any musculoskeletal contribution to the migraine, because, discs up in your neck at the top that are near the atlas and the axis, the first two vertebrae of your neck, disc problems there and pressure on the nerve roots there coming out and going to your scalp and down your neck, that may be a contributor. But in looking at food allergy through blood testing initially, because it's a simple screening, and then skin test on the arm, we can determine if you have antibodies being produced to certain foods. And it's amazing to see that in many people, once we take out foods that are showing positive on the skin test, people will start to say, my headaches are going away or they're gone. Same thing with bloating, indigestion, GERD, lots of other interesting things. Acne and pimples on the skin can be coming from a delayed reaction to a food allergen. So you could eat something today and you don't react to it at all, and you'd think, I don't have any food issues. And then testing, we take those out of the diet, and people say, I can't believe that my symptoms have changed or are changing. So maybe a significant contributor. And then if those migraines become severe or persist and the foods are not playing a big role, or those individuals start to develop cluster headache, you can watch some great videos here on the podcast or on the website about stem cell therapy for cluster headaches. I spoke to a young lady we treated a month ago, I think, and she was having horrible cluster headaches. And she will do a video for us because she is so thrilled. She says, you've completely changed my life. My function is back. I can play with my kids. I can go jog. I can do all the things that I hadn't done in years from one stem cell intravenous treatment and nasal droplet. She actually was referred, and she was from Louisiana, a lovely woman, by a gentleman that we treated, Tom, who's up in Nova Scotia, because 5.5 years ago we treated Tom, and you saw pictures here on the podcast of the surgical procedures. They implanted wires in his head. They did all sorts of crazy things. One stem cell treatment and no headaches since he did that procedure. And he's 5.5 years out, and he's, a world of difference. So, yeah, there's some amazing things that can be done that are just different than trying to put you on this drug, that drug, or whatever else. So, important to keep that in mind. And certainly take a look at the videos on the website or the videos on the podcast channel here on YouTube. You'll be able to see all this. All righty, we've got a caller. Hi there. How are you?
Hi. Is diabetic cause of pain, neck, shoulder, and knee?
Can a diuretic cause pain in your shoulder or your knee? That's interesting. It's hard to say. Usually diuretics that allow you to get rid of urine to take extra fluid out of your body, which can be used for a variety of reasons to lower blood pressure or lower swelling in your joints. I don't know that they would typically just create a headache or pain in your knee. Have they looked for other causes of the pains? Did your doctors do that?
I've been checked with MRI in my knee, in my hip, my neck, a little bit of arthritis, but nothing. But out of nowhere, it started from my neck, shoulder, knee only. That's it.
Neck, shoulder, and knee. Did you have any issues or injuries there before? Did you fall, have a car accident, or?
No, nothing. Even I went for, rheumatologist to check because I have, my mother had a rheumatoid arthritis. I thought maybe it's something.
Well, sometimes the testing for rheumatoid is negative a few times, and, you got to keep testing it because sometimes it'll pop up down the road. But my question is, do you have any disc problems in your neck or your back?
I don't have. No, I don't have any disc problem.
So the MRI showed nothing?
No, MRI showed nothing. Even nighttime, it was now I'm much better because Every night I'm taking, the dual pill, Tylenol dual pill, and I'm going through physical therapy. But it's such a weird pain, which even nighttime, in the morning to get up to start walking, I was like creeper people.
Yeah, so when you're laying down in your bed, your body's in a
horrible.
certain position. When
Very,
you go to get up in the morning,
no,
sometimes you
couldn't-
have
no,
aches and
even-
pains.
even I couldn't, even I couldn't roll in the bed. That's how bad.
Something
it was.
physical is doing that. So if you can't turn in bed and you have a hard time getting up in the morning as a result of lying down on your back at night, you may have shifting of pressure and pressure from the disc being placed upon the nerve root, which can cause some of that. You might have muscle spasm. Again, this is all a guess because I haven't seen any of your reports. Did they do an MRI of your shoulder?
They did. They did shoulder, neck, knee, and nothing really shows. Which,
Yeah, it's hard for me to
I have a
believe that
little
you'd
bit
have
of a-
nothing in the neck or the shoulder with the pains that you're having and you can't turn and move. So something's doing this. I mean, in weird cases, we've seen people that have had Lyme disease and didn't have any major issues with their musculoskeletal system. So I don't know. It would be a guess for me to try to figure out what it is, but certainly the best mechanism is to get me copies of the testing you've done, the MRIs and such. And if you're likely to do it, come in and get your big blood test done.
Oh, okay. How quickly you give appointment?
If you were to call and leave a message today, the office is open on Monday. We probably should get you in on Tuesday or Wednesday or Thursday. We always leave a few appointments open for people who want to get in quickly. Do you have the MRIs with you?
I have it. Yes, I have it.
Can you read the impression on the cervical MRI?
Read it now.
Just read what it says under impression.
I don't have it on my hand now.
Okay.
But I have seen so many of your, live, and I was wondering, even for my diabetic, I had so much struggling because
You're also diabetic?
They couldn't control it. For 2 years, it's been 3 months I'm under control. But for 2 years,
okay, so if you're diabetic, we could really help you out. We could really help you with the diabetes too, and to some extent, maybe the diabetes is affecting. Maybe the diabetes is affecting your nerves as well.
The stem cells helping diabetic or no?
Yes, we have people that are non-diabetic from one stem cell IV. It can take a few months for that to occur, but you can see that, and the videos are on the website too. A couple of great videos on diabetes and how people have become non-diabetic.
Type 1 diabetic or
type 2?
Type 1 or
type 2. Most of our type 1 diabetics, their medication requirement is extremely low because your pancreas is still connected to your blood flow, and putting stem cells in helps your pancreas. So, yeah, take a look at the videos on the website and give us a call. We'd love to help you out. Thank you for your call.
Okay. Thank you
so much. The phone number is 516-794-0404.
Okay, thank you so much.
Thank you, dear. Look forward to helping you out.
It. Thank you.
Okay.
Bye-bye.
Let's go to our next caller.
It's a good one.
Yeah, a lot of good information.
Yeah. We have some questions that have also come up.
Sounds good.
Hi, doctor. I want to ensure I'm getting a sufficient amount of amino acids, especially since I'm a plant-based diet. What are the best strategies for balancing my meals to cover all essential amino acids?
Well, yeah, test your blood, your test for amino acids. You can see what your body's doing. Look at total proteins, look at amino acids. For some people, we'll send out and look at fatty acids. We always look at vitamins, minerals, look at all that. So that's relatively easy to do.
And
I like the plant-based idea. I think that's great. I use a plant-based protein powder in the morning. Orgain, it's organic, and it's terrific. So no sugar. Makes a lot of sense.
And then they asked, should I be concerned about any specific combinations of food?
No, not really.
Okay.
Your body wasn't made to have one thing 1 minute and then wait a certain amount of time and have another thing. So
right. And then you kind of answered that on the phone call, but someone also asked, can stem cell therapy help with type 1 diabetes?
Yeah, so we have type 1s that have come in that are taking lots of insulin and lots of meds, and in doing the procedure, the stem decreases the inflammatory cascade so they feel better body-wise in general, aches and pains seem to go away, and just as it would if you had even rheumatoid arthritis, because stem cell helps to shut down the inflammatory mechanism. But we see those individuals requiring less and less of their medications and their sugars coming down. Many of them will still take medications, but they're in a zone where they're taking a very small amount of medication. So, learning about your body and fixing as many different things is the greatest idea of all.
All right, so we have another one, men's health. What are the top health screenings every man should get over 40?
Good question. So every man, and every woman, by the way, should be looking at vitamins, minerals, hormones. You want to look at testosterone, free testosterone, of course. You want to look at IGF-1, the active component of growth hormone. You want to look at all your cardiac risk factors, cholesterol, triglyceride, HDL, LDL, but you want to look at the breakdown of the 3 different types of HDL. The large HDL is the best of all because it decreases plaque risk. You want to look at the 3 breakdowns of the LDL. The small LDL will be the worst because that's the one that can become plaque. Heavy metals, by the way, you should test as well because they can bind with the bad LDL to become a foam cell, which becomes plaque. You want to do a sonogram of the prostate. Sonogram. Ultrasound. You want to take a look at the prostate. They put some gel across your lower abdomen and take a picture of the prostate because you can see the size and measure the dimensions with a little cursor in the sonogram device machine. You can see if there are lumps or bumps, which would be bad. You can drink a lot of fluid before the test so they can clearly see the bladder and the prostate, and then have you evacuate, get rid of as much urine as you can. And if you're not really getting rid of enough urine and there's residual urine, that's a problem. That may be because the prostate's a little enlarged. So you get a lot of information from the sonogram. Rarely, but sometimes we'll do an MRI of the prostate if we think that there's some sort of tumor process there. But PSA and free percent PSA are very important. So it's a gamut of tests that would look at the entirety of your medical condition. The blood tests we talk about, as we checked last week, I had the girls in the nurses station check, and we counted 230 individual tests. Shows us a lot of great information. We then have conversations how to correct vitamins, minerals, hormones, talk about peptides. There's a lot that we talk about that goes way beyond what traditional medicine would do.
Got another one. I have a desk job. What are the best ways to stay fit while sitting all day?
All right, there are a few people out there that are going to laugh at this, but when you're in the car, you're driving long distance, and I had done this with a prior girlfriend. You play music, and of course you're playing music that may be upbeat and stuff. You can sit there and dance, and shoulder dance and leg dance, and you can bop around the car. Sounds crazy, but you could do that at work. You may look crazy, but you could move your arms and your legs. You can use calipers to create some grip strength. You can do very light weights. In a perfect world, you may want to stand up, and if you have a lunch break, go out for a nice long walk or do a little bit of something at your lunch break. When you are at a desk job, you're kind of holding your body in place and it's not getting much of a result. There are some of these funny things on TV and the internet that's like a little pedals that people will pull out from under the couch and just pedal there. It's better than doing nothing, but I tell people either get up early in the morning, do a half hour of your exercise before you go to work. So get up, do whatever exercise you can, indoor, outdoor, whatever. Get showered, dressed, go to work. Then when you come home, do a little bit more. So there are ways to get around it. And certainly everybody should be dancing in the car. Safely dancing in the car.
What else we got? Or I guess this was following when we were talking about urine colors. But are multivitamins necessary, or is it a balanced diet enough?
Okay, great question, because most people out there think that a balanced diet is a good thing, and everybody's got a different idea as to what a balanced diet is. Or protein, vegetables, blah, blah, blah. A balanced diet is one that shows you great results with your blood test for your vitamins, great benefit with bowel function, and as odd as this sounds, you want to have so much fiber in your diet that your stool floats. because without the fiber, it won't, etc. So that's a good marker of having enough fiber. So we have to prove the diet's balanced. You know, some people have lots of carbs. And they think, well, that's a balanced diet because the food pyramid. It's bonkers. I see a lot of people that keep their carbs way down, good protein sources, and some people are vegetarian and others are not. But you see great results on their blood test, great physical capacity and ability. So it's got to be created for you, not just what someone else randomly says is a well-balanced diet. If you have what you think is a well-balanced diet and your vitamins are low, you're not healthy.
Right. We got one from Instagram. Do stem cells help giant cell arthritis?
Giant cell arthritis is an inflammatory mechanism where people typically either have some loss of vision and the blood vessel becomes inflamed. Because stem cells work well to shut down the inflammatory cascade of lupus, rheumatoid, and autoimmune disorders, and giant cell arthritis is thought to be an autoimmune mechanism, then yes, stem cells can help. Again, we also talk about vitamins, minerals, and the entire mechanism, but that would be an advantage.
We have a question about hair. Mm-hmm. Is it possible for it to be avoided, hair loss? Or is it just a genetic thing? It
depends on the individual. So some people have a genetic component to their hair loss, and because their father or their mother's father lost their hair early, then in some cases, those people are going to lose their hair earlier than they should. However, that doesn't mean that you can't take really good care of your scalp and your hair and try to improve, what you have. There are some people who work out and opt to take lots and lots of testosterone, which too much testosterone can create dihydrotestosterone conversion and cause hair loss. And some people that don't have the genetic component, if you look at a combination of different things like good amino acids, collagen peptides are very good for your hair, skin, and nails. Some people will use that capillus. It's a baseball cap with the lights in it that you can place on your head, once a day. There are different things that may help with your hair. Biotin might be beneficial. For a lot of patients, we've used PRP, where we take your blood, spin it, and inject the growth factors into your scalp to create repair. And for a lot of people who do stem cell therapy, inject into your scalp because you're making brand new cells to create repair. So there are different things that you can do that are natural, that are without risk. Some people might use Propecia, which is a medication that blocks the dihydrotestosterone. So there may be some advantage to that. There are probably a handful of things that you can do to try to help, stabilize and minimize your loss.
I know you've mentioned pellet therapy, but someone's asking just how often do you have to reapply, go back?
Pellet therapy for testosterone or estrogen, usually it's 4 to 6 months. So like anything else, it's an individualized mechanism. So some people have a testosterone level that's super low, and they've either tried creams or gels or shots, which are appropriate options, but the combination of those varies. So let's say someone comes in, their T is low, and clinically they're unhappy because, all the different things that come with low testosterone, anxiety, irritability, changes in hair in their legs. You lose hair when your testosterone goes low in your legs, sexual drive, dysfunction, etc. We may recommend doing a shot of testosterone once a week for 3 weeks to overlap it to get a great level so you can see what you're supposed to feel like. Then we might switch over to sublingual, where you're taking a little pellet under your tongue daily, which will give you some testosterone, and that can keep you at a good range. Other people like cream, but the testosterone pellets, the idea there is to place them under your skin so that they're there for 4 or 5 or 6 months. And if it lasts for 6 months and your levels are good for 6 months, you may only need to do it twice a year. But again, just like a person taking the testosterone under the tongue, that a person may want or need to come in once a month or so, or every now and then for the testosterone shot to keep their levels a little bit higher. And some people need a little bit more testosterone in the pellets. Some people need less. So it really depends upon what the blood work shows and a person's age and physical activity. There are 2 different types of pellets. There's one type of pellet that is a long-acting pellet sort of looks like a little bit larger than a grain of rice. That's oblong. And then the shorter acting pellet, sort of the size of maybe a piece of, black pepper that you might crush and put on your food, but one's round, one's oval, and those are placed determined by an algorithm as to, what that person should get. So there's a computerized algorithm for men and for women as to what dosage and how long. Usually you're pretty much hitting the nail on the head with the first placement, but sometimes you have to adjust. That can hold true for anybody.
All right. And then we have, hi, doctor, this might be a funny question, but is there a specific sleeping position that's healthiest? I came across advice that says sleeping on your back with your mouth closed is best. Is there any truth to that? And does sleeping positions really impact health at all?
That reminds me of a joke about men and women, and the wife wants the husband to sleep on his back with his mouth closed. So I don't know really. Different people are more comfortable one way or the other. So some people will sleep on their back and they're fine. If people have issues with sleep apnea, sleeping on your back may be an issue because the weight of the neck can push down and incur people to snore. Some people feel better on their side, one side or the other, and yet some people will change position. So it's not as though one position is healthier for a whole bunch of reasons that would negate doing the other. We just don't want people laying on their stomach because then if you have a pillow, you're cranking your neck backward, and that would be bad for your neck. And there's some cool pillows out there now.
Oh, yeah.
I've seen all these different things where you slide your arm under, there's a hole for your arm and your head, and, and then there are people who have pillows they like between their legs, or they have some massive bolster between themselves and their wives or their husbands so they don't get bothered. And, one always complain about the other, rolling away and taking all the covers. That's a discussion that will be ongoing till the end of time. Whatever works.
Got a question on essential oils. Do they really help with anxiety and pain relief?
For some people, yes. So if we have one category of natural things and one category of man-made drugs, the category of man-made drugs is created in a way to get a result as soon as possible. If a pain reliever drug or an anti-inflammatory takes a week to work, it'll never go anywhere. But if it works within minutes or seconds or whatever, then it's going to hit the market. Now, natural things may or may not work. They're natural, but some people don't respond to some of those things, just like some people don't respond to a drug. The things that we see typically work nicely for anxiety, and we do a workup for anxiety. If your testosterone's low, men or women, or estrogen's low for women, you're going to have anxiety. If IGF-1 is low, the active component of growth hormone, same thing. You may not be sleeping well, your mood's not good. Vitamin D deficiency in men and women can create anxiety and mood disorders. So there are a lot of things we want to look at to see what's causing the problem. Lately, a lot of people do really well with taking CBD, cannabinoids, and those are natural, they're safe, and can help to decrease anxiety, help people sleep. The other thing is I try to get people away from, I need to take this pill or a vitamin or that for this symptom. So anxiety also can come from low blood sugar, which I see all day long, every day. People that eat too much carb, or especially need to have something sweet at night when they go to bed, if they take in a sugary thing and their blood sugar goes up, your body dumps insulin, your blood sugar drops, you get anxious, irritable, panicky. And you could wake up in the middle of the night with that. You could wake up in the morning that way. Some people at lunch have too much carb, and by 4 or 5 o'clock, they're tired, achy, hangry, as we call it, hungry and angry. And that can precipitate some anxiety. So you want to look at the whole mechanism. We don't want to do natural things like we do drugs, just take a drug for a symptom. We've got to figure out the cause. Lots of calls today.
Yeah.
Glad my voice is holding on. I talk all day at work, as you can imagine. I talk too much as it is here. And, patients have questions, and we go into these long diatribes. And today everybody wanted to talk about my dog, which was nice. Saturdays is usually a little bit of a slightly more or less chaotic day, depending upon the day. But I mentioned the dog once, and then everybody who has a dog wants to see pictures of my dog. How big is she now?
They're coming to the studio soon.
Yeah, she's coming soon. I just got to figure out how to do that. Because Zeus would come in and just lie down and be cool and chill and just look around. But Delilah walks in and is like, oh, my God, look at all these things to smell and to bite and to, rub up against and to push around. She's just this very active dog who thinks she's a puppy, and it has to be the better of 145, 150 pounds. So she's used to be a little puffball when I first got her. Now she's a gigantic puffball. And she could just walk right by me. If I have black pants on, there's all this white fur and dander, so I try to brush her and wash her as off as I can. And she's very adorable, not needy in a way, but she loves to be right around you. And she'll just want to get something out of me, a hug, a scratch, or she'll just jump when I least expect it, and her paws are on my shoulders, and she'll just rub her nose in my face. I'm like, okay. But yeah, I've got to be, like a ninja to turn sideways at the right moment so that I don't get knocked down. But she's a sweetheart. Okay, 888-420-9272. We've got a few minutes left, I guess. We can see if anybody else wants to call in and ask a question. A lot of great info today. This reminds me of the radio show. We used to have somewhere between 25 and 30 people call in, and sometimes as I started the program, was talking about a topic or an idea, the board would light up with questions. And I'm like, wow. And sometimes we couldn't get to all the questions. So for those of you we can't get to you at the end of the program, then just email us through the website. We'd love to help you out.
Last call. I like the Saturday shows are,
Saturday's
always
good.
Flooding.
People are not working and running around and in the rat race, and Saturdays people have some time to sit back, enjoy, relax, in the afternoon, even if you work on a Saturday morning as I do.
Got a YouTube question on artificial sweeteners. Safe, or should they be avoided?
I'd avoid them because the chemicals that have been around for a long time are not really safe. I'm not talking about agave or some of the more natural mechanisms, but I try to get people away from having a sweet tooth anyway, so you don't want to use sugar substitutes like the saccharin and the equal and those things because they're chemicals. And there's to some extent, a lot of research is pointing towards them making people want to crave more sugars. So if I can get rid of the sweet tooth and you could really taste things that are healthy for you and give you a little bit of sweetness, that's fine. I would probably minimize exposure to those things.
Got it. And we got another one on YouTube. Will stem cells regenerate kidney nephrons that were burnt from naproxen?
So stem cell therapy and the mechanism behind there, and we see this with every organ, stem cells, once we do an IV, can go to the damaged tissue, and they're attracted by sort of chemical messaging, just like your antibodies are attracted to where you have an infection by chemical messaging. And they will set up shop and become new kidney cells, and you'll have more and more and more of those stem cells dividing and becoming new kidney cells in that organ. Same for your heart, lungs, liver, pancreas, gut, joint, eyes, brain, and you can see evidence of that on the videos on the website, and you could look up research on that. So when I started clinical trials many years ago, the clinical trials included arthritis of any joint, COPD, diabetes, erectile dysfunction, frailty syndrome, where people are older, they don't have to have a million medical problems, but to just help to rejuvenate their organs, heart failure, kidney failure, liver failure, MS, Parkinson's, stroke, pulmonary fibrosis, macular degeneration, diabetic retinopathy, all of these things. So there's a great deal of evidence that they'll become and turn into, the medical word is differentiate into, those damaged cells. That's their only job, and that's what they do. So in a short answer, yes. But you want to maximize the rest of the mechanism as well. So that's why we talk about, the big workup. Okay, thank you so much for listening today, for calling. Wonderful calls, a lot of great information. This is our record day for calls and questions. So we're here with Frankie and Sabrina every Monday, 12:30 to 1:30, and every Saturday, 2:30 to 3:30, taking your calls, chatting with you. Love to help you out. Certainly tell your family and friends about the program. If you could subscribe or like and email or text it to someone else, that would be terrific.
Subscribe to the YouTube.
Subscribe. YouTube, whichever platform you're watching it on. We're on a whole bunch of platforms. Some I've never heard of, but it's still pretty cool. Website is drcalapai.com. The office is 516-794-0404. Awesome. Thank you, Frankie and Sabrina. God bless you all, and have a wonderful day.